For this assignment, I chose to focus on the ethical dilemma of the understaffing in the healthcare setting. In an article by the online Journal of Issues in Nursing, it was found that the understaffing of nurses greatly impacts both patient safety and overall morale. The article reviewed a survey that was conducted in the early 2000s by registered nurses. The survey had two major purposes. First off, to identify registered nurses' perceived experiences with clinical errors, and whether or not those errors were a result of the nursing shortage, and if the nurses experienced moral distress as a result of these errors. The second part was to identify if registered nurses perceives that other nurses made clinical errors related to the nursing shortage, and if those nurses felt any moral distress as a result. This article also mentions another article by the Journal of the American Medical Association, and in that article, data was examined, and it was found that from 1998 to 1999, on over 200,000 surgical patients, a survey was conducted, and it was found that inadequate nursing staffing levels significantly impacted patient mortality. Also, nurses in this study reported that with increased nurse-to-patient ratios, they felt decreased job satisfaction and emotional fatigue. This survey was conducted on nurses from every state in the U.S., along with several other countries. The survey in the online Journal of Issues in Nursing. The results of the survey can be broken down into four main parts. The first part being that overall, registered nurse participants perceives that both they and other nurses made clinical errors related to not giving medications and or treatments and or giving them at the wrong time. In addition to the registered nurse participants perceives that both they and other nurses experienced clinical incidences related to patient falls, pressure ulcers, unplanned patient readmissions, restraint use, and nurse injury. The second point was that overall registered nurse participants perceives that the clinical errors that they and other nurses experienced occurred largely as a result of the nursing shortage. The third point was that overall registered nurse participants perceived that the clinical errors related to the nursing shortage that they and other nurses experienced resulted in moral distress. The fourth point was that consistently registered nurse participants perceived that other nurses made clinical errors and or experienced untoward clinical incidences related to the nursing shortage more frequently than the registered nurse participants. So, all in all, the survey found the nursing shortage to be strongly correlated with clinical errors. The article concluded by saying, finally, regarding the study in general, it is vital to find out how the shortage may contribute to errors. It is not helpful to use the shortage as a general scapegoat for errors and unsafe incidences. More study is needed to understand the impact of the shortage for daily nursing practice. Since the shortage is expected to become worse, it is important to examine how to help nurses in practice now and protect nurses in the future. To support my position on this issue, I chose the ethical framework, the common good approach. This approach was created by Greek philosophers Plato and Aristotle, and they promoted the perspective that our actions should contribute to ethical communal life. The main point of this approach is that the best society should be guided by the general will of the people, which would then produce what is best for the people as a whole. This approach to ethics underscores the networked aspects of society and emphasizes respect and compassion for others, especially those who are more vulnerable. It is crucial that nurses are provided with adequate staffing in order to do their job to the best of their ability. They should not feel that they should not feel that they do not have enough time to care for all their patients, and they should not have to choose which patients to provide with the attention and diligence they deserve. Having appropriately staffed healthcare facilities is what is best for the people as a whole.